So very good evening everyone. Hope I am audible and visible. A very good evening everyone. Let me know in the chat box if I am audible and visible. So first of all, I would like to wish each and every one of you a very happy Doctor's Day. A very happy Doctor's Day to the budding doctors, the doctors in the making. And we know sometimes this journey can be a roller coaster ride. There are, bumpy roads on the way, as we are considering or we are seeing that there are certain jitters when NExT is coming up. But all these are part of this journey, and we all have made it so far, and I'm sure you are going to make it in the future as well. So whenever there is doubt, I always say always remember why you had started. And with that message, let us start with today's important session. So today we have joined and we have come live for an important discussion. So all of you have seen, we have discussed previously, past few videos, we have talked about the NExT, the implications of NExT, and also I'm sure all of you must have seen the recent, Gazette which has come for the NExT. Now, previously we were getting drafts, but now finally we have got a Gazette. That is, we have got certain regulations regarding the NExT exam. So I'm sure there are certain again clarifications may be coming up on the way, but there are certain important implications which we have with this NExT Gazette. So in this video I'm going to talk and I'm going to focus on those updates. And today's session I'll try to cover some of the queries, some of the doubts which the students who are right now in interns or post-intern phase, and many of the students might be doing some government job who would be planning to give exam for PG entrance. So one group will be that. Second, we would be covering those who are in the final year, and also we'll be talking about students right now who are at the preliminary years, in the basic years, that is the one and first and second year of MBBS. So I'll try to cover all these important domains in the discussion today. Right, so let us begin. So again, very good evening everyone. Right, so again there are certain implications, few things before again I'll start, that we have certain implications for our Indian medical graduates and we have implications for the foreign medical graduates. Certain clarifications are still not there, so we'll talk about that as well. But if you see the trend, or if you see the changes which are occurring, if you see the pace, so we were getting drafts, and now finally we've got a Gazette, we have got a regulation. So you can see the pace, or with which they are planning. Again, when this will be coming, we'll talk about that in the end, what would be the duration. But if you see the pace, it seems they will sooner or later it will be going to come. Whether it will be November, whether it will be May, that's not still clear, but it seems that we are in that direction only. Now one message for students who are there in the intern, who are there in the intern and the post intern batch, one clarification they have given, that for those students at least this time it seems there will be a NEET PG exam, as they've clearly mentioned in the Gazette that they will cease, they will slowly they will cease that exam. It's not that abruptly they will end. So it seems most likely that for those students there will be a NEET PG exam. Okay, now coming to the Indian medical graduates, so we all know from the previous videos, we know that there is going to be NExT step 1 and NExT step 2. So let me just briefly tell you. So this NExT exam, it's going to be a licensing exam. That is, if you have to practice modern medicine in India, it is required that you give this exam, and also for getting a rank in the PG exam. So those two things you should be remembering. Now for the Indian medical graduates, what we know is that this NExT 1 step 1 is going to replace the theory exam. It's going to replace the MBBS 2 theory exam. So with you don't have to give a theory exam, it will be NExT step 1. But there is going to be a practical exam which your university will be conducting. So there will be the practical exam, and once you pass this exam, we'll talk about what are the implications, how you're going to pass this exam. So once you pass this exam, then you are eligible to your compulsory internship. While coming to the foreign medical graduates, who have completed their undergraduate medical education overseas, they have to, for being eligible for the compulsory rotatory internship, they have to just pass the step 1 theory. That is, just have to give the step 1 theory exam. Now, so again, for grant of license to practice, one has to complete the duration of internship. So, if given next step 1, you've completed the internship, then you have to pass, step 2. We'll talk about step 2. Again, they have clarified it's a practical or a clinical examination which will be going to there. Coming to the, the duration or when it will occur, they have mentioned that, the time schedule and the modalities of the next step 2 shall be decided by the NMC with with the universities or the appropriate institutions after completion of internship. So it seems that the next step 2 would be after the internship. And for admission of the postgraduate medical courses, the eligibility is that you have to get a your rank will be calculated from the raw score of next step 1. So from that they'll give you a score, and that will subsequently will be deciding your rank. So in rank, again they have specified something like normalization. So again, what is this normalization? So this next step 1 rank or the score, raw score which you will be getting, they're going to normalize. So suppose somebody has given a next step 1 score previously, and somebody is giving it right now. So how will they get a rank? So they have said that they are going to normalize. So again, in fact, when the CBT or computer based test had started, the exam was not conducted on one day, it was conducted on multiple days. So students were getting different exams they were getting, and they were getting different scores, and subsequently they formed a method, statistical method, and they normalized the rank. Subsequently that will be followed. So suppose somebody is giving next step 1 and somebody has given previously, so if they have to calculate the rank, they will normalize the score. So this has been mentioned, and subsequently they can participate in the counseling. So this is the eligibility. Now coming to the next step 2, it's a additional practical exam. Okay, it's a practical exam. Again, it will be conducted, and again this exam will be based on a lot of clinical skills. We'll talk about what are the important points which will be covered in the next step 2. Now, one very important update which they have given is that the step 1, which is going to be an MCQ based exam, it's going to be an MCQ based exam. So it is not just going to have single best answers. So if you've seen the trend, it seems that again previously when INI-CET has introduced this, that there are going to be multiple types of MCQs, such as there will be single best answers, match the following may be there, true and false, multiple or combination of answers may be there, and assertion reasoning type questions may be there. Now I want to again first focus on the type of questions which they are going to ask. Again, they have mentioned in the distribution of items and the knowledge of the level of questions which they are going to check. They have specified they've specified that they want to discourage rote learning. They've specified in the Gazette that they don't want students to just mug up things. And they are going to emphasize on case units, they're going to emphasize on clinical cases. So in fact, they have given this that problem solving, analytical skill type questions will be around 60 to 70%, and comprehensive type would be around 20 to 30%. So you can see the basics or some of the most important topics which you should know would be covering as high as 90% of your exam. So now understanding the clinical concepts, trying to integrate would be very, very important. Only 10% of the questions will be recall type. So this is what they've mentioned. In fact, this distribution may vary, and most of the questions, it seems as they are emphasizing it again and again, so that overwhelming pattern of examination will be clinical based. So they've mentioned this clearly in the Gazette. Certain things they have left space to change, but this thing they have mentioned that overwhelmingly it will be a clinical based exam. So this is a very important implication. We'll talk about that, how this implication, how in Prepladder we are going to help you in this implication, that the pattern will be, majority of the pattern of the questions will be clinical based. So this is an important. Now coming to the frequency of exam, now let us in fact understand, please everyone, a lot of anxiety is there. This point I want to discuss in detail, and I want you to understand what they are trying to tell you. Okay, so when we talk about the frequency of exam, first of all they have mentioned that the step 1 will be a twice a year exam. Now the step 1 has two implications, so we'll talk about that also. The step 1 has two implications. One is to pass in the step 1 exam you have to get 50. So there are 6 exam will be there. We have talked about this in detail. There will be medicine and allied subjects, there will be surgery and elite subjects, then there will be obs and gynae, there will be pediatric exam, then there will be ENT, and there will be ophthalmology exam. So these are going to be under this 6 important domains. They are going to integrate all the remaining subjects. So again there will be 6 exams. Again they have given a they have proposed a timeline again, but they have again mentioned that it's only an indicative timeline, and again depending on the logistics they will again update. So let us assume right now this is the timeline we have now. So very important is they mention that for your step 1 you have to score 50% in all the exams to pass the exam. So that is one implication. So to pass step 1, so because after passing step 1 you will start your internship, and that step 1 also has an implication later on when your rank for PG courses will be decided. But it has 2 implications. Let's try to understand it slowly. So first is to pass, you have to start the internship, you have to pass the exam. First point. Okay, let's talk about the we'll talk about that how this rank will be there, we'll talk about later. Okay, now number of attempts, what they have mentioned is there is no restriction on the number of attempts. It is going to be twice every year, and but it is few things are important when we talk about the number of attempts. First is you have to pass the exam. I'll talk about what they mentioned, and after passing step 1 you'll do your internship, you'll pass next step 2, and then again you can improve your score by giving next step 1. And again you can repeat as many attempts, but should be within 10 years of joining the MBBS course. Please understand, it is not from the passing of MBBS, it is from the joining of MBBS. Within that time you can give as much attempts as you want. So you can improvise your score. So suppose you're not satisfied with the score you have got in next step 1, which is going to decide your NEET PG rank. So you can give attempts, but the next step 1 attempt you can only give after completion of step 2. So again this is very important. So you can give it after completion of next step 2. So that, but when you give the next or the last next step 1 exam, that will be your final score. So your previous next step 1 scores will become invalid. So previously in the draft they'd given certain of averages, those things they've removed. They've said that your last next step 1 will be the valid one for your rank in the PG exam. So that is again something very, very important. Okay. Now let's talk about this pass which I was discussing. So suppose in your final year it is replacing your theory exam. So minimum 50% raw score is required in each of the 6 papers. This is very important that you have to pass. It's not an amalgamation that in some you get more percentage, in some you get less than 50 and they will aggregate. No, that you have to get minimum 50% in all the exams. They've given again they've given certain scenarios, certain explanations, that suppose if a student scores minimum passing in 2 subjects and he is not able to do it in the rest of the 4 subjects. Let us say this is a scenario. So that student in the next in the next cycle, which is going to occur after 6 months, then he can appear for all the 6 exams, but if he passes on those subjects in which he has failed, okay, then he will be considered pass. Okay, so this is again very, very important that you have to pass to, you call yourself you have passed next step 1, you have to pass in the remaining. But please understand your score, the total score, if you have to apply it to get a NEET, you have to get a next rank for the PG rank, then that last score will be only valid. So then you have to give it with some seriousness. So you cannot afford to think that okay 2 subjects I've already passed, so let me just focus on the remaining 4. So you have to focus on that as well. Okay. Now another scenario they've explained, suppose in this next cycle of step 1, so out of the 4 subject, when the person was not able to pass, he passed on another 2 subjects. So 2 subjects are now still remaining. So now he can again repeat the exam in the next 6-month cycle, and if he pass on the remaining 2 subjects, now he'll be deemed to be pass the step 1. So it has 2 implications. Please understand, when you are in MBBS, when we are giving a theory exam, let's not always think of again, let's not increase the anxiety. Let's try to understand. So to pass and to start your internship, you have to pass the exam. Of course, the the next score, that raw score will be coming, which will be utilized for your ranking. Yes, but again there is a provision, you can always improve. But of course, our suggestion is, whenever you are giving the next step 1, try to give it with your best attempt, so that you don't have to repeat it. And second of all, that score will be very useful for your ranking in the PG exam. Now there is one again one fine thing which again I think needs clarification, is the negative marking. I'm sure all of us are thinking, so it seems a bit not right if one is considering it as a pass exam to start the internship. So if there is negative marking and you have to score at least 50%, it seems some sort of harshness. Again, they have said that in the mock test, which is coming this month, so they've said that negative marking will be there, but right now there is no clarification that the negative marking will be there or not. So let's wait and watch. So there may be 3 scenarios. One we have just discussed, that suppose they have a negative marking, so it seems may become a bit difficult. But there may be a scenario when they think of not including the negative marking, or there may be another third scenario in which when you are giving it the exam, considering that you have to start your internship and you have to get 50% to pass the exam, maybe in that situation they may not apply the negative marking. And when they're calculating from that score, they're calculating your rank for the PG, maybe then they may include negative. This is another I'm sure they have not specified something like this. So it seems that let us wait for the again upgradation. But again, as we are seeing, it seems that they are thinking a lot about it, and they are planning also. So that is why we have this gazette with us. So I hope this step 1 is clear to everyone, because you need to understand your concepts well. Again, there are there are many students from our times, even our junior time, our senior times. Even in future there may be some students who would want to just pass the exam. They may plan for other streams. So it's we were thinking that you have to give this exam, you have to get a rank. No, you have to just pass the exam. Okay, if you are considering doing something else, so you have to pass this, you have to do internship, do step 2, and you will get your license. So again, so we don't have to everybody should not think of this rank, and let's try to understand it with some calmness. So this is about the 2 scenarios which we have discussed. Now let's talk about calculation. Again, they have specified as we are discussing, there will be a raw score, and up to appropriate decimals they'll get this score, and they'll convert it into percentage, and subsequently they'll get a rank. And this score, again, please remember, if you give your next step 1, so suppose you give it now, it will be valid for the next 5 years. So again, these things, again in future we may find that these things are very useful. So again you can get a rank. You have given this step 1, and based on that you can get your rank. Okay, if you're not willing to give again. So this is valid within that 10 years of joining the MBBS, during that duration, and within 5 years of that it is valid. However, again, if you appear it for the next another one, so your previous one will become invalid. This is again point we have discussed. Only the last attempt of next step 1 will be considered for ranking. Now please understand, one more thing they have mentioned is, if you want to, suppose you're giving this exam, suppose you're giving it for your final year exam because you want to start your internship. So they've given you an option. It's not necessary everybody who will be giving this exam, a rank will be generated. Please try to understand. You have to mention that you want the rank to be generated. What will be the procedure of that? Again, they will mention, but they have specified that everybody will not get the rank. Only those who have asked for to get a rank, they will get a rank. So before before giving the exam, you have to mention of the rank generation. Again, this is important. Now again, certain thing about tiebreaker rule that they have mentioned is, they are going to normalize the sum of raw scores of the subject in the single next step 1 examination. So suppose somebody has already given next step 1, and now some new students are giving next step 1, and if they want to get a rank, so they will normalize it. Again, the example which I just mentioned, that previously multiple exams would occur, so they will form a statistical method, they will form so that a normalized score is get, and then based on that they will give you the rank. Now in the tiebreaker is that somebody who has given less attempts will be given a higher rank. So the less, again, those who are giving it the less time, so it's better if you get a good rank in the first attempt. So again, you will get a higher rank compared to someone who has got a exact same score, so their rank will be lower. Now suppose again there is some discrepancy, so then next will be the preference will be given in the order of marks you have got in this order. So somebody who's got higher marks in medicine and elite disciplines, they will be given preference, and this is the list up to ophthalmology. So this is the list in which they will compare the marks. So again, these things again are important to know. Now again, nature of score we have already discussed. The raw scores of the 6 subjects will be converted to percentages up to appropriate decimals for step 1. Step 2 is going to be a pass and fail exam. It's going to be a lot of clinical based scenarios will be there. We'll talk about this. Now let's talk about this next step 2 pattern of exam. So it's going to be an objective structured exam. Clinical based questions will be there. OSCE type questions, objective structured clinical examination type of questions will be there. Simulated cases and patients aimed at evaluating certain practical skills. So they would want that whether abdominal examination, whether CNS examination, whether you can do normal procedures like inserting a cannula or a catheter. So those things may be evaluated. Clinical decision making, again this has been one of the important part. Even previously for the final year exam students, they would give you a case and you have to based on the case you have to make decisions regarding the treatment. So that part also will be there. And very importantly, this is very important, communication skills, how you are handling things, if you are dealing with the patient, so how you are handling things, how is your communication skills. Okay, that will also be tested. So again, this is very, very important. These skills will be tested. So again, you can see that a lot of emphasis is being given on the examination and your communication skills. So this will be the pattern of step 2 exam. Again, the frequency they've mentioned, it's going to be again every 6 months. So again, it's an opportunity, again it's an opportunity that all these exams are occurring every 6 months. Earlier it used to be 1 year. So this is something which is, I think, in a better direction. Now those of you, those of the students who have not passed, suppose if a candidate fails in 1 or more subject, which is less than 3 subjects in the step 2, they can appear for the supplementary exam. Okay, now but if a candidate is not able to clear more than 3 subjects, then they have to repeat all the 7 subjects. Again, it's an important implication which you should remember. Okay, so this is again important. So this is some important things again regarding the counseling they have mentioned. So they've given you a timeline. Again, I'm not going to repeat. We know from a discussion that next step 1 they are planning in May and November. Okay, and again they are going to plan similarly every 6 months. They're going to plan the session. So this they are planning now. But again, first and the main counseling will be again as per the Gazette in May and June. And also there is a provision that those seats which have left, that seats will be covered in the December counseling. So just like a mop-up counseling we have, so that counseling session will be held in the December. Okay, so these are some important Gazette upgradations they have given. Now again, I'll just try to just recapitulate few things so that we are clear with what information right now we have. Okay, first is students who are interns, post interns, it is most likely, as they have mentioned, that they are not going to just completely change the pattern, they are going to do it slowly. So it seems that for them there will be a NEET PG exam till the time they feel that it is okay to shift it to completely. So let us see, it seems this time it will be a NEET PG exam. Okay, now about the foreign medical graduate exam, again they have not clarified. Let's wait and watch, and let's see what they are planning to do, because we would not want to again create any kind of panic. Let's try to wait and watch that what are they going to do. So for interns, post interns, it is one of the best time. So I want you to understand, this is one of the best time that it seems that yes, NEET PG for you is going to happen. And again, it's a best time. Try to study, try to improve your clinical. Again, you don't have to start from the scratch. You have made your basics right. You have to again just improve upon them. Okay, and just focus on the NEET PG pattern. Some of the clinical questions which they have been asking, that they will ask. Okay, so just focus on that. Okay, don't have to panic and don't have to, change anything, suddenly. Just see the previous pattern. They've been asking certain types of question. It seems that will be the way around. Okay, now students, again, in the final year and, and subsequent batches, again, this is something important for you. Okay, now when this will happen, again, we don't have clarity, but seeing the pace, let's see, be ready. I would say, again, will not create any panic. Be ready, again, what you can think is the worst is that it will happen this year. So seemingly, just think about that and keep on improving. Again, you don't have to change, everything, again, please remember, medicine will be medicine, psychiatry will be psychiatry. So the basics will remain basics. So try to improve on the clinical, scenarios. As we are discussing, a lot of clinical questions, will be there. We discussed yesterday also, regarding the QBank we are, proposing, and, it will be coming, on 10th of July. So again, we are going to help you in that, specialty as well. So don't worry about that. Now, the, one more message, for students who are in the first year, second year, I want you to understand that all these subjects will be allied. So your, your first year, second year subjects are very important. They form the basics. So it's not that you will start studying these subjects in those years. Okay, focus on the basics, focus on the important things. Again, if you see, even our videos which we have, our faculty from the first prof and the second prof, you will see a lot of integration. We have been doing it, continuously, and you will see a lot of, when you will start applying, those information in the question, you will see that you have been taught, the integration in the videos as well. So you just have to focus on the basics. So these are the three groups, I want to, tell that this is the information we have. So what is this implication of this guideline? So what's the implication now? What does the student need to, change about? You don't have to change. The subjects will remain the same. Please understand. Yes, more focus may be there on these 6, important subjects. So maybe, if you are planning to give the exam, and maybe if suppose it occurs in November, again, when you say November, they have not mentioned it will, they have mentioned this, that it may change. So maybe December also, just let's take it November. So, again, focus first, complete those 6 subjects, very, very important, and try to integrate all the subjects. Your community medicine, your forensic, again, they have specially mentioned, again, will be a lead. And you've been seeing the previous pattern. Look at the previous pattern of questions. A lot of questions on forensic, poisoning have been asked so many times previously in the recent exams. A lot of epidemiology, if I say about psychiatry, has been asked in the previous exams. So they have been, giving. So if you see the recent, PYQs also, you will see, a lot of implications, integrations they are doing. You don't have to worry. It's a new name, it's a new kind of exam, but your core will not change. That you need to be satisfied with. That will ease out your anxiety. Don't have to start again from the scratch. The basics you have built, you have to just keep on building and keep on improvising. This is a very important message for all those who are, again, thinking a lot. Certain clarifications, I agree, there is not there, but seeing the pace with which they have just put this regulation, maybe after the mock exam which occurs, we'll get more clarity. So let's wait for that. So let's not jump the guns and just wait and continue preparing. This is another important message I want to convey. Continue preparing. Don't waste this time. Many a times, the difference may come in this, in this few weeks, which we may waste thinking about it. So let's wait, let's, it's a good thing that they have at least given this, regulation at least now. So we have some clarity, and let us hope for more clarity. And again, some subjects are important, but other subjects will be important as well. They'll be integrated. Okay. So your main course videos, your rapid revision videos will remain important. So, why do we believe that, we are in this best position, to help the students? Again, we have been emphasizing this, in the back end, we have been having this discussion for quite some long time. We have been, again, because this, the word NExT has been there for so much time. So even, while we were preparing, our content, so we had this in mind, and that is why we have taken, nearly a year, and in fact even more behind the scenes, to give you India's only true clinical question bank. Again, I'll emphasize, in the Gazette, they have clearly mentioned that case minutes, clinical cases, scenario shall be the overwhelming pattern of examination. They've clearly mentioned this line. So clinical cases, it seems, will be the very important part. So therein, our question bank, again, whatever resource you are using, again, we are not saying that you change the resource right now or giving the exam. but again this QBank will be a very important QBank for you guys. In fact, everybody will be important. So again, we have built a lot of concepts. Again, our video 5 version, videos, again, they are all conceptual videos, and based on that, our QBank is based. Okay, so this is very, very important. We have added a learning outcome, a summary of explanation. Again, it will be very handy. Treasures we have given. So just a quick revision, if you want to just revise some topics, you can just go through them and it will become very, very useful for you. So right now we feel that this QBank is one of the important, modalities which you should have for your preparation. Also keeping in mind that we have students who will be appearing for NEET PG. So we have this switch version will be available. Again, it will be available from 10th of July, wherein you can one question we have framed in 2 ways, a clinical and a one-liner version. So you'll have both the options available. So those who are planning for NEET PG exam, again they will also have that advantage, and of course you can also see the clinical version. So this is something which we have updated, and again I'll say what we are launching. We are launching a pro pack. Again, it's a pack with QBank, with a lot of clinical questions. We'll be having test series in that, as well as the treasure package. So these 3 things we are giving in the pro pro pack. So this is again an important feature which we feel, again, a lot of hard work has gone through that, building this QBank. Again, we will also provide the switch. And in the NEET PG version, we have 50% clinical questions and 50% one-liners are there. And in the NExT, question bank, we have a lot of overwhelming questions of clinical, scenarios are there. And we will launch this flip feature, feature also on 10th of July. So this is again another important, message which we want to convey. So again, please remember, topics will remain the same. Please remember. Your only the framing of questions is going to change, and please remember and understand, if you're seeing the previous pattern, they are subconsciously giving you a lot of clinical questions. So don't think that I am not in that clinical, answering those clinical questions. You are in that frame of mind. It's just that the number of questions is going to increase. And why we are saying, again, it seems that more of the questions will be clinical in the next exam if you see the duration. So in all the exams, whether it is medicine, surgery or OBG, or the remaining 3 subjects, so you see each of the question you will get around 1.5 minutes. So that seems that a lot of clinical information will be given. So that is why if you get into the habit of solving those clinical questions, you will be able to understand the concept well, and you can answer the question. So this is what we have for you all. Okay, so this QBank again is built to improve your concepts. We have been giving you the concepts in our videos, and this will add up in building the concepts. It will help you in retention. We have given certain treasures, learning outcomes. So you can always, in short duration, you can revise some of the important topics, and it will increase the question solving acumen. Again, for NEET PG, we have given the clinical questions and one-liner version as well. Okay, so this is something which we have been building, and this NExT, since it is coming soon, so we would want that all of you should take advantage, and we would be there to help you in the journey ahead. So don't worry, don't panic. This is one important message I want you to understand. Okay, so who are again, those of you have completed internship right now, those who are in internship, it seems that for you guys, again I'll repeat, it seems there will be a NEET PG exam, as they've mentioned that they will slowly fade off that exam. So till when they will be having it, don't know, but it appears this time they are going to have it. So this is again important information. Okay, certain exam, and next step 1 is going to replace the theory exam, okay, of the final part 2. So these are some important conclusions. And again, wishing you all a very happy Doctor's Day. Don't worry, we are there with you. Any queries you can always ask us. Thank you.